So we know in diabetes management that the dietary approach, can be complex, can be difficult and challenging for people. But there are some things which are the basis of that, which is we look at carbohydrate intake because carbohydrate is the nutrient which has the main effect on blood glucose, and we look at weight management, particularly in type 2 diabetes. So, so both types of diabetes, type 1 and 2, carbohydrate is important. And a key source of carbohydrate is, of course, sugar. Free sugars or refined sugars are something which is, going to have a potentially huge impact on blood glucose. So when it comes to the use of sweeteners, really it's about providing those options and choices for people with diabetes so that they can still enjoy sweet tasting foods without the effects on blood glucose. And the key area is drinks. That's the area where you can't really replicate that sweet taste in drinks without the use of sweeteners. So it's quite important to establish that the use of sweeteners in drinks does not cause any increase in blood glucose. And research has done that. So a recent meta-analysis by Grayling has done that. And it's also important. Some people will be quite critical that actually sweeteners can cause an insulin response. And the meta-analysis by Grayling also proved that that's not the case either. So we know that sweeteners do not cause an increase in blood glucose and do not cause an increase in insulin. I think that's going to vary from person to person, and I think some people want to use them as a way to, manage their intake of sugar, replacing sugar, and use it as a stepping stone to reducing that. But for many people, they will be a long-term solution. I used the example of drinks earlier on. You can't, if you're thinking about a sweetened carbonated beverage, there isn't really anything that replaces that that doesn't contain either sugar or a sweetener. So for a lot of people, it will be a long-term solution. And certainly, I know patients who will, forevermore, if you like, be using those sweeteners either in hot drinks or by switching to the low and no calorie sweetener versions of their favorite carbonated drinks, for example. So I think, if that helps them to maintain the sorts of dietary changes that they're aiming for to achieve the correct, effects on blood glucose, then yeah, there's no reason why it shouldn't be long term. And the safety data for sweeteners indicates that within the ADI, which in my entire career I've met one person who came close to the ADI. It's perfectly safe to consume those sweeteners over the long period of time. Yeah, I think if we separate diabetes out into type 1 and type 2. Certainly type 2 diabetes, weight management is a key focus. We know that about 85% of people with type 2 diabetes are overweight or obese. And so therefore, energy or calorie intake is very important. But we have a calorie reduction target around free sugars for the whole population. And so, there's good evidence already of the contribution that sweeteners have made to that for the entire population, which will include the 4 million or so people with diabetes, because they're part of the population as well. And there is some evidence from research that you can get about a 10% reduction in energy intake by switching from sugar-containing foods and beverages to sweeteners. So yeah, definitely the two things go hand in hand. That there's a reason why free sugars are a public health target. No, no, not at all. And what the evidence suggests is that where these sweeteners replace sugar, and that's key, they need to be replacing sugar, you can get small reductions in weight loss. So they can contribute to reduced calorie intakes and small reductions in weight loss, in particular in overweight people. So, so we're not talking about the whole population here, but in overweight people where they replace sugar, you can get small reductions in weight loss. And so, no, they most definitely play a part.